Howdy folks, it's Kevin Chaikin again, and this video is going to cover your Medicare benefits, those basic benefits, and your enrollment timelines. So let's start with the four parts of Medicare. If you don't know already, parts A, B, C, D, and Medigap. We'll go into each one briefly. Part A is your inpatient care. So an inpatient hospital stay, a skilled nursing facility, home health, and hospice. I like to think of Part A as inpatient room and board, but that's what you're going to get under Part A, which is typically going to be $0 per month for most people. Part B, that's going to cover outpatient. I would just think of this as everything outpatient. So medically necessary services, doctors and healthcare providers, preventative services, surgery, ambulance ride, emergency room, durable medical equipment, chemotherapy, physical therapy, radiation, OT, ST, all these things that are outpatient are covered under Part B. And there is a monthly premium associated with Part B, which could vary based off of certain income factors, and it does adjust every year. Part C is your Medicare Advantage option. I like to think of Part C, that C standing for combined, combines all your benefits into one plan. So you get Parts A and B now, instead of from the government, they're through the insurance company. Usually they're going to include Part D, which is prescription medication coverage in there. As well as things like dental, vision, hearing, maybe a gym membership, over-the-counter allowance, transportation, extra chiropractic or acupuncture, all sorts of things that Medicare may not cover or they may add to Medicare, but it does need to meet Medicare standards. So those benefits do need to meet minimum standards that are set by Medicare, and then they can add those extra things on top. These plan designs are managed care, so are HMOs, PPOs, point of service, private fee for service, Medicare savings account. Those are the plan types. A lot of HMOs and PPOs, which you'll see out there. So they are network based. Even if you have a PPO, which has flexibility out of the network, still a network based plan. These are offered all by private insurance companies, and they are paid by the government to manage your care. So you keep paying Medicare for Part B, and the government's paying the insurance company to offer these additional benefits and manage your care. Part D is your self-administered prescription drugs. So self-administered outpatient prescriptions. This is also through private insurance companies. So to be clear, Parts A and B are the only Medicare parts that you will get from the government. Okay, that's not something that I'm going to provide you a insurance policy for Part A and another one for Part B. That's government Medicare through the federal government. Everything else, C, D, and Medigap, dental, vision, hearing, all through private insurance companies. So Part D is either a standalone plan, or if you get Part C, it's typically going to be included in the Medicare Advantage plan. It may cover some injectables, although other injectables that are in an outpatient setting at a doctor's office, for instance, oftentimes are covered by Part B. These are more retail and mail order options at the pharmacies, and you can typically go to almost any pharmacy. For most plans, there are preferred and standard, which may impact your pricing, but ultimately pretty flexible options there. Medigap. So you have to have Parts A and B to enroll in Medigap. You can't just say, I'm getting a Medigap policy only that's going to cover everything. That's not how it works. Medicare is primary. The Medigap policy is secondary umbrella coverage. So it sits right behind the Medicare. And when Medicare is done paying, supplement steps in, pays their portion. Okay, so it's secondary coverage. Helps with a lot of deductibles, co-pays, co-insurance. It can greatly reduce your out-of-pocket exposure since your exposure on original Medicare has no limit. These plans are standardized. So Plan G from each company has the same medical benefits. Plan N from each company has the same medical benefits. So there's no difference in how you use this policy, where you can go, what gets paid, what gets done. Medicare decides if something's approved and who you can see. Then that insurance company who's offering the Medigap plan, standardized process, standardized coverage, it will work the same way. Now, how do you enroll in Medicare? What are your enrollment periods? The most popular one that people obviously need to be aware of is when you turn 65, which is your initial enrollment period. You may not go on Medicare at that time, but it is when you need to start paying attention. So that's 3 months prior to your birth month, and then the month of, and then the 3 months following. So you should be doing something with Medicare at the very least 90 days ahead of your 65th birthday, if not 6 months to a year ahead of time to start planning. Other enrollment periods that are out there are special enrollment periods, annual enrollment periods, and the Medicare Advantage open enrollment period. Appreciate the patience there. The initial enrollment period, as I mentioned, 7-month window, 3 months ahead of your birth month, the month of, and the 3 months after. You enroll in the 3 months ahead of your birth month. They will not start sooner than your birth month unless you were born on the first day of the month, in which case everything moves forward 1 month. Enrollment in the month of or after is going to start the first of the following month. You can do this online. I highly recommend doing it online, or you can walk into a Social Security office or try to get a phone interview. I would definitely get ahead of the game if you are going to enroll in person or over the phone by trying to get an appointment maybe a month ahead of time so that you're not waiting until the end of your initial enrollment period to get that done. But online typically is the best way. You can enroll in Part A or A and B at that time. For special enrollment periods, these are available year-round. Very frequently, you're working past 65. That's going to be a time when you're going to delay Medicare Part B especially, and use a special enrollment period any month of the year later on to get enrolled in Medicare. If you change where you live, if there's a 5-star plan, if there's some other factor that impacts you, could be weather, could be a FEMA disaster, COVID was an example. So there are special circumstances, and those SEPs are year-round. And the length of the enrollment period will vary as well. So it's important, obviously, to make sure you know what you're doing. This is why you talk to somebody who obviously knows what's going on to help you do this properly and transition on the right day of the right month. Now, annual enrollment, that is October 15th through December 7th every year. This is for folks who are already on Medicare. It's not for Parts A and B. It's for Parts C and D. So you're going to enroll in a new Medicare Advantage plan or a new drug plan. You do that from the 15th of October to the 7th of December. The last enrollment selection that you make during that time will go into effect on January 1st. The 6 changes that you can make during AEP, kind of alluded to them, but it's Medicare Advantage to a new Medicare Advantage plan, or it's original Medicare to a Medicare Advantage plan, and it could be Medicare Advantage to original Medicare. There's also one Part D plan to another Part D. There's an initial enrollment into Part D, and then there's to opt out of Part D entirely. Those last two happen very infrequently, but it does happen. Maybe you missed your enrollment period for special enrollment on Part D because you only had a 63-day window after your employment ended and you missed it. Well, that makes a lot of sense. You've got to wait until annual enrollment to take care of that later. The open enrollment period. So Medicare Advantage open enrollment. This is from January 1st through March 31st. It actually is the same time frame as the general enrollment period for folks who did not get Part B on time and don't have a special enrollment period. Totally different enrollment periods, but same exact time frame, Jan 1 to March 31st. If you're doing a Medicare Advantage open enrollment period, you have to be enrolled in a Medicare Advantage plan to utilize this enrollment period, and it allows for a one-time change from one MA plan to another, or to drop an MA plan and go to original Medicare and add a Part D plan. If you're in this time frame and you're using general enrollment, that's not because you're on Medicare. You would have just Part A probably at that time, and then what you're getting is you're adding Part B because you didn't do it at 65 or you didn't have a special enrollment period. So the process for turning 65, your initial enrollment process, again, use ssa.gov to apply for A and B. 3 months prior, the earlier the better. If you're going to do it in person or call, do that even further ahead of time so you can get an appointment. Begin that Medicare education process, 3 months at least. I'm a big fan of 6 to 12 months. I'd love to talk to people that are 12 months out, 9 months out, 6 months out, because you're not rushing to figure it all out at the end. But obviously 3 months is fine as well. We'll make it happen if it's 2 weeks. Don't leave yourself that little time, but that's what we are accustomed to doing if it's needed. You apply for plans. I would generally say you apply for plans anywhere from 3 to 6 months prior. I like to have your benefits situated from really from 60 to 90 days ahead of time. Sometimes I certainly would say no less than 30. And sometimes you can get certain things done ahead of time, like up to 6 months for certain supplements. So depends how prepared you are and how much you want to get done. There are some benefits to doing things early in terms of cost and just checking things off your list, but no less than 1 month. And then welcome to Medicare. So 2 weeks prior, you should have all your cards in your hand if you're doing things in these timelines, and be ready, be educated on what you're going to do, and then start 2 weeks later. So first day of that month it starts, you should go ahead and start using those benefits. Now, a special enrollment period, the timelines are very similar, a little bit different process. If you're going if you're working past 65 and you're using an SCP, you need a document from your employer called an a CMS L564, which is what's going to prove you've had creditable coverage since you turned 65 and allow you to enroll throughout the year and avoid penalties. Definitely would get this 3 or 4 months ahead of your desired start date so that you can apply for Medicare Part B, which is using CMS 40B at the 90-day mark. Again, the sooner the better you can do the government stuff. The sooner you can do it, the better, because it can take, sometimes it's 2 or 3 weeks, oftentimes it's 4 to 6, maybe 8. It just depends. So get it done early. Again, I would electronically do that in that 90-day window. Begin your Medicare education process. Like I said, 3 to 6 months, 6 to 12, do it early, knock this stuff out. Applying for plans and all the rest of this is the same thing. Do it all before the 30-day mark. Like I said, 60, 90, 120 days. It all pays off at the end to get this stuff done. You might save a little bit of money on your premiums, but ultimately what you achieve is peace of mind and understanding of what your benefits are. So that's it for the parts of Medicare, the benefits and the enrollment process. As always, if you have any questions, reach out, and thanks for watching.